the trachea tube into the mouth, strapped around behind the head, and then you would tape around this post and ET tube to where you want it, the insertion depth you want it.
That actually is kind of cool because a lot of people get a lot of skin breakdowns from that tape when you tape around their whole head.
These actually cause a lot of problems too.
Oh, really?
Every type of device that you see out in the marketplace is not without its pitfalls and problems.
I mean, when you're taking it off, it...
That too, so that's just one of the problems there. This type of device is designed to go over the top of the mouth this way. It's like a Velcro strap, and the same type of thing is that you'll basically clip this in here and you'll tape around the ET tube, okay, strapped around the patient's head, all right, to the insertion depth you want as well. Then you have a device like this. This is actually made by Marpac. This is a pretty cool idea. It's pretty well refined. It kind of ties into both concepts of having something to mount it with, and then it's actually like it's really a pre-made tape type of a device that you slip behind the head, and I'll show you how the tape works. So this is a pre-made tape, if you will. And finally, the good old trusty dusty thing that I like to use the most. You know, Jennifer said a lot of people have tissue breakdown from it. There is some occasion with people that have tissue breakdown, but all these other devices, and I've used virtually everything on the marketplace at some point in time or another. I haven't had as much success as I've had with just good old-fashioned cloth adhesive tape for holding the ET tube in proper position. In other words, those type of devices, I've had ET tubes slip in and out, or get misplaced, or come out altogether because they're not properly utilized, or they're just not that effective. I've always had the best success with tape. How do you feel?
Tape. Makes sense. Tape.
Yeah. With the tape, what you want to do is you want to take the cloth adhesive tape, take enough to kind of go behind your own head like this, come out about 6-8 inches beyond your own face. Okay, that's going to leave you enough tape to get started with. Tear it off. I like to find some flat spot on the wall. You know, not much of a flat spot there, but it works. Take about 6-8 inches of cloth adhesive tape again. What you want to do is eyeball the center and put the tape right over the top of it. And this is designed to prevent the hair in the back of the head from getting all matted up inside of the tape job. Okay, I've actually had to cut tape and hair out of patients because somebody didn't do some of that stuff. Now the other thing I do, like Marpac has his own little guide stick here. How do I get underneath the guy's head is sometimes a problem. Can you open this for me, please? Grassy. Tongue depressors or popsicle sticks are just wonderful little tools. A lot of people will use these. Just apply it to the tape like this and fold it back over onto itself. I always do it at a little bit of an angle so that if it gets too matted up, I can get it off. All right? And then what I do is with the help of somebody holding the ET tube, we'll pass it through. Okay? Slip it through, and she's going to keep it taut. Okay?
Not the same with the
Okay, there you go. And you want to try and equalize where the tape in the back of the neck is. And then this is the way I do it. I'll leave that one. You want to do that one first?
No, go ahead. I'm just going to have it.
What I'll do is I'll tear the tape about in half. And I try to go to just about the corner of the patient's mouth. Okay? And I use the inferior, the bottom one, to use as my anchor. I'll come across the upper lip and nose, and I go back towards the patient's earlobe. If I have any extra, you hold this one for me?
Yeah.
Oops. I'll tear off the extra. Always put a courtesy tab on it where you flip over the end of it, and then you want to mold it to the patient's face. Okay? Take the other one, I come across, and with the ET tube, my technique is I come across the top.
Okay.
Like this, and I usually use the tube and I lift it up this way, and wherever the insertion depth I want at, I want to make sure I make note of it where it's going to be at the lip line, and I wrap the tape around it without having the pilot line in here, and you go back over onto itself a couple of wraps. Make sure you don't pinch the lip in there at the same time. Again, with the extra, I tear off the extra stuff, make a courtesy tab, and finish the wrap. If you notice I go right over the top of it, like I've done, is to keep it in one spot so I can see the entire tube. The tube is clear for that reason. Your partner can help you out and they can start the next one. And then what I do, again, knowing that the top one here is going to be my anchor, again this is the one that actually ties the tube, I'm going to come across the top. This mannequin's not really well shaped. And I'm going to do the same thing. I'm going to lift that tube up. I'm going to wrap it the other direction for the top side, back over itself a good couple of wraps. And I mold the tape around the ET tube. Now this stuff is real sticky and you'll make mistakes. You can back it off. And finally, I think I got enough wraps. You only need a couple, 2 or 3 wraps around it. You don't need to go 25 times. It's not going to make it any better. Okay, make a courtesy tab, bring it around, mold it, and then I bring the last piece over the top of everything, going back towards the patient's ear, tear off the extra, and then courtesy tab that, and anchor it down, and mold it all